So millions of Americans have abruptly lost their Medicaid coverage, and for many of them, it had nothing to do with whether or not they were actually eligible. It was a paperwork error. Now, during the pandemic, states were not allowed to drop anybody's coverage, and as a result, enrollment in Medicaid and the Children's Health Insurance Program, otherwise known as CHIP, jumped from 71 million in February of 2020 to 93 million in February of 2023. That protection ended in April, causing nearly 4 million Americans to lose that coverage. Let's bring in financial expert and Madison Ventures Plus Managing Director, Mitch Roschelle. Mitch, always good to see you. Explain this to me, because states knew that this deadline was coming. How did so many people lose coverage over clerical errors? I mean, what kind of paperwork issues are we even talking about here?
Well, Marky, good morning. They sent notices out to the people who were receiving benefits from those two programs. And I've seen some of the letters that went out from the different states. They literally looked like junk mail. So a lot of people just neglected to see it. People have not had to reapply for either CHIP or Medicaid for all of that time, 3+ years in many cases. So people forgot that there was basically an annual enrollment. And then on the state side, they literally weren't adequately staffed up for the paperwork. There was a process that those states had in place for rolling re-enrollment. However, they haven't had to do it in 3 years. So between the bureaucracy in the states and the fact that people didn't even know they were getting the notices, this is what happened.
Yeah, I was reading stories this weekend about people who didn't realize they had lost said coverage. They show up at the pharmacy to pick up routine prescriptions, and all of a sudden they owe the full amount. It's become a nightmare for folks. What can people do if they did, in fact, lose their coverage, but they're still eligible to receive it?
Well, they can reapply. And, one of the challenges there, Marky, is the paperwork conundrum just, continues. So there are people who actually filled out the forms and the state rejected it because the form wasn't filled out the right way. So you can certainly re-enroll. You are eligible for Obamacare. That's each state has its own marketplace. You happen to mention CHIP. And let's remember one thing, that Medicaid is need-based as opposed to Medicare, which is age-based. So if you do need the coverage, you can get insurance through the marketplace at either a reduced rate, in many cases a significantly reduced rate, and there are some tax credits that are available to you. But it's literally, unfortunately, it's just paperwork. You can do it online, but it's one of those, sort of painful processes.
Yeah, I was also was reading about the wait times for these call centers. I mean, some of these states, folks are having to wait upwards of an hour. I think Idaho, the average wait time was like 50 minutes to get on the phone with somebody to sort things out. Last question for you. Any tips for people who lost coverage and need to know what other options that they have now?
Yeah, and the one I would say that if you are in this problem where you have no insurance, unfortunately, get on the phone and do what you can. Go onto the state's marketplace and apply for insurance. If you haven't yet, what you can do is you can enroll for insurance through the state marketplace up to 60 days before your Medicaid would expire. So, the sooner you get a jump on it, the better.
All right. Good to know. Mitch Roschelle, thanks for joining us on your Monday.
You bet. See you soon.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.